This is Natalie Meyer, CEO with the El Paso County Medical Society, and today I am meeting with Dr. Berliner, who is our physician spotlight. Welcome, Dr. Berliner. We're really excited to have you join us. So we have a handful of questions that we're going to go through today, and we're going to start with what first inspired you to pursue medicine and what sustained that sense of purpose through your career?
Thank you for asking that. When I was in high school as a sophomore, I remember having a biology teacher who was very impressive, but she also developed malignancy, and she ended up not passing away during the school year. And I always wondered what I could do to make that not happen, meaning keep her alive or prevent her from getting sick or treat her for being sick when she is sick. And of course, as a sophomore high school student, you can't do very much about that. But that inspired me and it made me want to pursue medicine. And that really turned me from not having much focus to having focus. And in my career in medicine, my goal was to hopefully prevent disease. And realistically, there's not a lot of opportunities to do that in today's medical community. And I ended up doing more of clinical care in aerospace and emergency medicine.
Mm-hmm. You had just mentioned you had a career that included military service, aerospace medicine, emergency medicine, and community leadership. When you reflect on that journey, what has been most meaningful to you?
Well, I started my medical career in a funded program funded by the U.S. Army. That there were only 7 in my year group. It was not the current health profession scholarship program. This is in the 60s. And I wanted to combine medicine and the military because the military allowed me to go to medical school. And I owed a lot of years for that because of that. And so I looked at specialties eventually that would help me to combine my interest in medicine, which is a physician, and also my enthusiasm for being in the military because they got me to become a doctor. And I chose aerospace medicine because it was a combination of both. It looked at military programs, space programs that not a lot of us in medicine get involved in, but it also allowed me to look at high altitude, hyperbaric deep sea diving, and couple that with my own interests in clinical care. And I branched off through a lot of moonlighting in my first few years in the military to be able to tackle emergency medicine as well. Because I knew aerospace medicine, while a fun, interesting title and specialty, didn't have a lot of marketability outside of the military. And at some point, I was going to leave the military. But I was able to use my aerospace medicine background to help with projects that the Army allowed me to be involved in. We funded a research program on top of Mount Everest, climbing Mount Everest, looking at the effect of low oxygen availability on the ability of people to function, and looking at medications that might prevent altitude sickness, high altitude cerebral edema, and high altitude pulmonary edema. We also did a program in a laboratory at Natick, Massachusetts. And at Natick, it was called Operation Everest 2. It was based on Mount Everest in the altitude chamber and looking again at ways to prevent mountain sickness, which are 2 diseases that I mentioned, the cerebral and pulmonary aspects of that. And I also, through aerospace medicine, was able to later, after I retired from the Army in 1986, I was able to develop a aeromedical evacuation program for a Native Health Corporation, the Yukon-Kuskokwim Health Corporation in Bethel, Alaska. And we became an international medevac company that was very successful. But the primary reason we were set up was to take care of villagers from the 58 native villages in an area the size of the state of Washington that we serviced who could not get into Bethel for adequate medical care without flying on a fixed-wing airplane. And we became the avenue for them to get in for their health care instead of them having to fly in a mail plane, which was not medical, and spend many, many hours and days sometimes getting to Bethel for basic medical care.
What did serving patients and practicing medicine in this community mean to you during your years of practice?
Well, when you say this community, I must, I think, include the entire state of Colorado, because that's where I started. After I finished medical school, the Army assigned me for my internship at Fitzsimmons, which was then called Fitzsimmons General Hospital. And I had an opportunity to experience Colorado. I had only been here once, and that was in 1960. And from then, that became my home. And I, of course, was assigned many places by the military, including 2 combat tours, one in Vietnam and one in Thailand. And yet I always wanted to return to Colorado and was able to do so in the early 90s when I had finally left active military duty and went to Alamosa, where I ran the emergency room at the San Luis Valley Regional Medical Center. I had a lot of contact with Colorado Springs at that time because our patients who were acutely injured and ill needed more stationary hospital care than we could provide in Alamosa. And we often moved them both to Parkview and Pueblo, to St. Francis, the parent of St. Francis at the time, which is not then became Centura, and Penrose Community Hospital. And also, of course, we used Memorial Hospital and sent patients often to Denver. So it was working in these communities that I got to learn a lot about what Colorado is about, what Colorado Springs is about, and make hopefully a contribution in improving the lives of the people who live there, particularly in the rural communities. And we, in the early 90s, developed the 4-level trauma system for the hospitals in the state of Colorado. Ben Honigman, Larry McNatt, I, and a few others were able to put together a trauma system where hospitals like the one in Alamosa became a level 4 trauma center, which didn't mean a heck of a lot at the time, but did help us to structure the movement of patients who were severely injured. And we had a lot of those kinds of patients in the San Luis Valley during the early 90s. So I incorporated that with my workings with the folks here in Colorado Springs. Ted Lewis, who you may have heard of, who was Director of Medical Education in the Penrose system in the early 90s, introduced me to Colorado Springs in terms of clinical medicine. And that continued when I returned in 2013 from military duty. I had been recalled as a retiree to help out with the war effort, and from 2005 to 2012. And coming back to Colorado Springs, I worked not in emergency medicine anymore, but in urgent care, and developed the urgent care practice for the Matthews VU Group in 2016, and continued with them until I left clinical practice at the end of 2023.
How did the El Paso County Medical Society add value to you as a physician when you were practicing, and what does it hold for you now in retirement?
I was very blessed to have become part of the El Paso County Medical Society and realize that that was a great place to contact colleagues and people who thought similarly to the way I did in terms of providing acute care. And I was, of course, spent a lot of time in acute emergency medicine and urgent care. I developed a lot of contacts. In fact, I from my contacts in the medical society, I brought a number of people on board to Matthews View Group, like Keith Stamfer, who passed away a few years ago, but who was a great family physician and somebody who helped us an awful lot taking care of patients in the urgent care environment. So it was the contacts that were really important to me. And I must say that when you came on board as the director of the society, you made a huge impact on all of us in improving the way we interface with each other. And the work that Dr. Piantanita and his team have done and Gabriel have done to help us has really been a key aspect of my involvement in the society and involvement in Colorado Springs medicine.
Thank you very much.
You're welcome.
What has shaped your passion for making Colorado a place where physicians in training, and I'm going to start over on this one and give her the pregnant pause. Yep. What has shaped your passion for making Colorado Springs a place where physicians in training and newly boarded physicians want to stay and practice?
It's a great question, Natalie, because Colorado Springs is a great place. However, in terms of medicine, we have a history of being a smaller community as opposed to the community above us, Denver. And having trained in Denver, I know that at the time in the late 60s, early 70s, Colorado Springs was not medically the same as we were. I think this has been changed significantly over a number of years. The improvement of the hospitals themselves, whether they be newly built or rearranged, the incorporation of the University of Colorado to the Colorado Springs community has made a big difference in how we practice medicine and how we are viewed by others outside of the Colorado Springs area. And I try to encourage younger folks, including my own son and daughter-in-law, to come practice here. At the time, when they finished their training, their residencies up at Denver Health and University of Colorado, respectively, they didn't feel they wanted to come to a smaller city and did not. But they appreciated the fact that their dad, father-in-law, really was enthusiastic about practicing medicine here. And I think we can encourage more and more people over time to come here. We've gotten some more mature colleagues who have come here in their later years and have enjoyed being here, and that's important for us to point out to other people. My own daughter Amy is a junior undergraduate student in pre-med at CU Boulder, and I am hoping we can encourage her in time, if she indeed continues the medicine, to include Colorado Springs on her sites.
What wisdom would you most want to pass along to the next generation of physicians as they choose where and how they want to practice?
Another great question. The wisdom that I will talk about is not necessarily what I know clinically. I think I know a fair amount of things, but people learn things and they're learning things much better than when I learned them. The technology is better, the information is better. But how are they working with people, with patients, with themselves? How much empathy do they have? How much concern do they have when somebody says, I don't feel well, to really find out what that means? Not just, oh, they have a strep throat, we can give you Augmentin or some similar antibiotic and you'll get better. That's nice, but that doesn't really look into what's going on with them as people. And what our job is as physicians is to work with people and work with communities and try to help improve how people live and feel in a community, not just their immediate illness. Remember, you and I are going to get older. And as we get older, and I'm a little bit older now, I can tell you I have to go see my colleagues. And sometimes I'm not necessarily treated as someone who needs much care, but hey, doc, you know all that stuff. Just take care of yourself, or what can I do to kind of tweak things for you? That's not why I'm there. I'm there for you, Dr. So and so, to help me get through this, because being older isn't fun, but it is something that happens. And I think if we can teach our younger physicians and younger medical students the fact that they get older too, and they need to be treated, they will want to be treated with the same care and caring and empathy that they should be projecting to their patients now. I think we make a huge difference in how the practice of medicine is and how they can contribute to the communities.
In the season of retirement, what continues to energize and inspire you?
Well, being retired is interesting because some of it's a lot of fun and some of it is a little boring because you don't have the same daily tasks that you did when you were in practice. Uh, that said, I have been able to become involved with the El Paso County Medical Society, like I'm saying right here today, and that is extremely useful to me, not just to fill the time, but to learn more of how I can be more productive and more effective and efficient to help my colleagues and help my community. I serve on the Colorado Medical Society Workers' Compensation and Personal Injury Committee under the auspices of Chet Seward, who's the political, I want to say, liaison with the Colorado Medical Society. Very influential and useful, helpful person who we are doing a lot of things to try to improve the welfare of workers, employees who get injured. And we're doing, I think, a pretty fair job of attacking that. I also was appointed by Governor Polis in 2024 to the Nurse Physician Advisory Task Force for uh, Colorado Healthcare, called NPATCH. Uh, NPATCH is an interesting group of 12 people. 5 are physicians, 5 are nurses, and 2 are community members. And we have been tasked through the governor's office and through the legislature to look at things such as the immunization of all Coloradans based on some of the changes that have taken place at the federal level recently. We also were asked to look at artificial intelligence and how we can do a couple things. One is keep in line with the governor's enthusiasm for having Colorado be a center for artificial intelligence, which it is becoming, and also to protect the privacy and rights of patients who might feel uncomfortable with an artificial intelligence working with them in patient care. So I've been able to use those 3 areas as things that help me to tackle the lonely days of retirement, which they are, but also days that I have filled with things that are, I think, very interesting and hopefully very useful. I might mention that I also have a lot of time now to improve my work in the voluntary areas. I spent quite a bit of time in the 90s, from 1993 to 2002, helping try to improve the health status in emergency care in the country of Vietnam. And I did so with some colleagues who had the concept with me that we could help to repair some of the wounds that we created as a result of the Vietnam War. As you probably know, my wife, Luana, is Vietnamese. We spent a fair amount of time back in Vietnam trying to help promulgate some of these ideas It's hard to do, but it's things that we have our heart and our passion into. I also returned on active duty in 2005 to 2012 at U.S. Army South to help with the war effort, although it was in Central and South America and the Caribbean, not in Southwest Asia. And I did so by projecting medical activities where we provided rural health care to very indigenous and needy populations. We had the opportunity to have President Bush visit one of those activities in 2007, in March of 2007, and his 15 to 20-minute quick stop turned out to be an hour and a half. And I spent a lot of time one-on-one with him and his wife, helping him to understand what we were trying to do to help people in the developing world on behalf of the United States.
Well, it sounds like that's a great story for another time.
I think it is.
And I do also have to mention, you're very busy and you're very active and quite engaged. And I don't know if you've heard this term before, but instead of saying retirement, people call it rewiring. Have you heard that one before?
I have heard the term, and I think I'm somewhat rewired, I hope. But thank you.
Yes. What is one fun fact or personal interest you would like for your peers to know about you?
Well, this all started, this fun interest, in 1969 as an intern at Fitzsimmons. When John Norton, who Dr. Norton is, retired here in Colorado Springs. He's an internist trained at Fitzsimmons as I did. And Ramsey Millett, who unfortunately passed away a couple of years ago, who became a dermatologist and Mohs surgeon, trained some of the people here in Colorado Springs at Vanguard. But the three of us would trek up to Loveland ski area on Loveland Pass almost every weekend if we weren't on call. And I learned how to ski in very long wooden skis, cable bindings, and leather boots and wooden poles. And it became my passion. I love skiing. I am very careful not to get on the slopes much anymore because breaking a hip is not on my agenda. But with Ramsey and John, I was able to spend a lot of time learning to ski. John Norton had learned, because he's from Buffalo, New York. Ramsey from the Carolinas was like I. We didn't know too much about skiing, but we were rapid learners. And I spent many years in both military and as a civilian, as a retiree from the military, working with ski patrols both in New Mexico at Sandy Peak, down south at Sierra Blanca. I was on ski patrol at Wolf Creek for many years as a physician advisor. I may not be an expert skier, but I certainly was able to help out and was able to help some of our colleagues, our folks who came from the flats to visit us and to ski and wondered why they weren't doing so well. My aerospace medicine was able to contribute by helping them to at least understand what altitude sickness was and what hopefully to do about it, and that is get off the mountain and get well. But they wanted to ski, so we try to help them out in those kind of austere situations and get them to at least enjoy part of their ski vacation. So I spent a lot of time with skiing, and I enjoyed it. And I have to thank the folks who I mentioned earlier, Ramsey and John, for introducing me to skiing. And that was the most pleasurable thing I did during my career.
Well, thank you so much for joining us today. We really appreciate your commitment to service, your commitment to the community. So thank you very much.
Thank you.